Yeah, some very good questions coming in from our viewers. Okay, so this is another question by James Sutton. Should children who were previously infected and recovered from SARS-CoV-2 receive the vaccine, and what clinical studies have been done on children who have had the infection? Related to question is, why should one who has recovered receive the vaccine, since the natural immunity has been proven to last at least 8 months and possibly years? It's an interesting question there.
Dr. Armstead, do you want to? I'll go first on the natural immunity piece. We get this question a lot. Dr. Armstead, I'd love to hear also how you answer this question. So it is true that you get some natural immunity. What that means is if you've been infected with the virus that causes COVID-19, you receive some protection naturally from having that infection. The challenge is that while some people will have very strong and long-lasting protection from that natural immunity, some people are going to have less strong, less long-lasting immunity. And what's really hard to predict is who's going to be in which of those groups. We do know there are people who have had COVID-19 who have gotten reinfected with COVID-19. With the vaccine, you can be more confident that the level of protection you're going to get is very strong and that it's going to be long-lasting. And that's something that scientists, we continue to monitor. We already know that it's very, very strong protection for at least 6 months, and we expect it'll be longer as we continue to monitor that.
I agree completely. And, we've had many cases where a child or an adult tests positive for COVID and we draw antibodies and the antibodies aren't there. And so we don't have as good data that there's a robust antibody response to natural infection, whereas the vaccine was studied based on looking at those antibody responses. So we do have really good data that the vaccine will bring on that immune response. So we do encourage anybody who has had COVID infection to also get fully vaccinated.